So my lab is always interesting to study how the colon cancer to start to metastasize, especially in to colorectal cancer. So today I want to show you how we identify the bone morphogenetic protein 4, or BMP4, play a role during this process. Each year in the United States, more than 140,000 patients have been diagnosed with colorectal cancer. 50% of them will be develop metastasis, majorly in the liver size. As we know that cancer patients die through metastasis, not through the primary tumor. So this make the colorectal cancer be the second leading cancer-related cause of death in the United States. If left untreated, this kind of patients only live 9 to 15 months. Several approaches have been used to manage this disease. Hepatic resection is a gold standard for cure intent to treat this disease. Right now, have a 5-year survival rate can reach 35 to 55%. However, only 15 to 20% of the patient can be available for this kind of operation. And recently, another surgical technique called radiofrequency ablation, which uses high heat to directly destroy the tumor. Although right now it's used in a perioperative purpose, but this technique is easy to use and have very low mortality rate and keep improving of the instrument. So right now, a lot of medical centers report very long-term outcomes can be comparable to the resection. And 5-FU combined leucocorin is a very long time for only one chemotherapy agent to treat this advanced disease, but responsible rate is quite low, it's only 21%. But last decade, 2 new drugs, irinotecan and oxaliplatin, had ended the treatment and then increased the responsible rate to 45% and can manage the patient life to 20 months. And even recently, biological agents, the antibody that generate even against to VEGF or EGFR, in combined with chemotherapy, can extend the patient's life a couple months longer. And right now, a new development called neoantigen therapy that you can combine chemotherapy and biological agent to shrink the tumor from unresectable to a resectable form. And we know that resectable form have a better outcome in the clinical. So for all this variety of the treatment, biological agent seems kind of contribute significantly to improve the patient's life. But is there any available biological molecules can be used for the therapeutic target? To answer this question, that we had to better understand how the metastasis progression is going. So early in our lab, I used a microarray to compare the low metastasis and high metastasis colorectal cancer cell lines, and we find out that the bone morphogenetic protein may play a role to this process. And from the name, we know the BMP can promote bone and cartilage formation. It's a cytokine. It belongs to a TGF-beta superfamily, and more than 20 different isoforms has been identified. It's play a very crucial role during the embryonic development. They present all over the body. They have very broad activity to regulate different cellular function. Like a TGF-beta signal pathway, that BMP ligand bound to their receptor type 1, type 2 complex, and they will activate phosphorylation. In the BMP signal pathway, they use phosphorylation 158. For TGF-beta, they use SMART2 and 3. And this phosphorylation SMART will form a complex called SMART or SMART4, translocates due to the nucleus binding to the promoter of target gene and result either activate or replace the gene expression. So first, I'm using immunohistochemistry to examine the expression level of the BMP4 and its receptor type 1A and receptor type 2 in the colon cancer different stage, from normal mucosa to small size, large size, adenomas, early, late stage carcinoma, metastasis to the lymph node and liver. And you can see that this is using my micro tissue array setup. See, in the receptor, there's no big difference. They're all expressing very high in all the cases. But you can look at the BMP4. When they go to a late stage of carcinoma, more case was on a very strong side.